So we welcome all of you to join us for that evening. Okay, so we are going to move on and start our productions, our presentation this evening, which is really to talk about our return on our first medical mission in 3 years. The last time I was at the, this is where I'm going to run into a problem. Okay. The last time I was in Bangladesh at the Brothel was in March of 2019. And we have been going to that brothel since 2014. So it isn't easy to get to Bangladesh or Nepal for that matter. And what we do here is put the word out about looking for different types of healthcare professionals for our medical mission program. And we found a group of nurses and a social worker, and we took off on March 10th, a long trip, besides leaving here from Portland to Boston on a bus. And then everyone carries 2 bags, 50-pound bags, as you can see here in one of these photographs. This is our team, and also our bags that Marietta is graciously pushing. We managed to push them all over from Portland to Boston, Dubai, and on to Dhaka into Tangail. So it's a long haul to get there, and we managed to do that without any events. And it's moving. Could someone go get Paul for me, please? Or Julie? Maybe this is it. Sorry for this.
Next slide, is it?
Yes, I'm just trying to get to the next slide, but it's not going. Oh,
There
okay,
you
there
go.
we go. Sorry about that.
Why don't you reduce that? Can you reduce, just click,
Yep,
nope, no, yeah, there you go.
just want to make sure I see it though, if I want to see it up at the top. Yeah. Oops. Okay. So just to give you a little bit of information about the brothel. I first went to the brothel in Bangladesh in 2013. We were invited in there for a tour. And the next year we went back. After that discussion in 2013, we asked the madams in the brothel what they needed most, and what they really wanted was healthcare, because they are ostracized by the community in many different ways and have a hard time going into the hospital to seek healthcare. So I said, well, that's fine. We can come back and do primary healthcare. And that's what we did the following year. And we did that every year until, and our last time was in March of 2019. So our focus this time was to provide primary health care to the sex workers and their families in the brothel, and also to provide education and training to the nurses, to other healthcare workers at the Tangail General Hospital and the Tangail Nursing School. Many of these government hospitals have a 3-year nursing school attached, which Suzanne will go into. In addition, we also implemented under Suzanne Parkman's leadership a research project that was approved through the IRB at the University of Southern Maine. And we worked with a group of medical school students, some of whom had already graduated from medical school, which you see here in this photo of the 5 interpreters. A medical school in Bangladesh starts after you graduate from high school, and they go to medical school for 6 years. And then when they graduate, they're medical doctors. And in our country, as you know, it's 4 years of college and then 4 years of medical school. So plus internship and residency. And so some of these girls were about to finish and graduate. And I think one had already graduated from medical school and was moving on to her internship program. They were absolutely terrific, and each of us had an interpreter. They ask all the questions, translate for us, and really try to explain what's going on. And you can see that most of our transport in Tangail, which is a village of millions of people, is done through a tuk-tuk. And we negotiate that and get them in the mornings and in the evenings. And that's how we move around this big city. So I'm going to, before we go into exactly what we did in the brothel, I'm going to introduce you to Francine Knight to tell a very special story, because we just didn't go to Bangladesh this time. We actually went to Nepal, and we were up there for 6 days. And you never know when something in your life is going to just take another turn. And that's what happened. So I'm going to have Francine share her story about the Nepalese ostomy nurse story.
Well, Elizabeth, I volunteer at Partners in World Health, and Elizabeth contacted me by email, shared the email with me from Saraswati, from she's in that photograph there with me. She lives about 20 minutes drive outside of Kathmandu in Nepal. And she had sent an email. She found us on the internet, of all things. And she sent an email to Elizabeth asking about ostomy and wound care supplies, explaining that she had been a lecturer in nursing, she had her degree, and she had followed up with a program in the wound ostomy continence nursing certification program that was the same program that I was licensed in. I did my training through the US, and I did an on-site training, and Saraswati did it through Canada's program and did it online. She used the same textbooks that I used, although I'm sure the copyright was newer. This is her office that she has opened up in the base of her home, attached to her home. She has a son and a daughter, so she has 2 children also that she cares for. And the clinic is the first wound ostomy clinic in Nepal. She asked us for supplies, and she was able to tell us what she wanted in terms of wound care, which was mostly specialty dressings and ostomy supplies, and ostomy accessory supplies. When we looked into this, there was no way we could ship them to her. The cost for shipping is over, it was hundreds of dollars. Excuse me. And so what we ended up doing was I sort of suggested to Elizabeth that it would be great if we could include this in our trip. And she was just assertive enough to go and to think about how we could do this. And she talked to Dr. Arun, who is a doctor that she is familiar with. She met him in Bangladesh, and she knows that he's in Nepal, and she's talked to him. And between him and Saraswati, we ended up having an entire week in Nepal, where we visited their hospitals and visited her clinic. I'm still in touch with Saraswati today, discussing via email different problems and issues. There also is an ostomy nurse in the hospital, in Patan Hospital in Nepal. And that nurse has a mostly administrative job. Most of the care for ostomies is done by the junior nurses. They do not have any special training in ostomy care. And there's an issue with supplies, getting them and learning how to apply the appliance and how to care for any issues that develop. When I looked into the history of ostomies, the most recent information I could find was 2007. And when they did the survey and collected data from Asia, Bangladesh and Nepal were not included in the data. So I don't think there are any statistics, at least there aren't any recent statistics, unless they're very recent, for ostomy situations. There's very little reimbursement, and supply comes from a clinic rather than a hospital. Patients obviously they don't order these appliances and get them from their doctors. So by setting up the first clinic, what she's doing is reaching out to patients and getting supplies to people who normally would be using homemade care, using towels and things like this for an ostomy. The ostomies in Nepal, like here, are mostly for cancer of the rectum and of the colon. Sometimes they are also ulcerative colitis type of diseases, but they can be temporary or permanent, just as they are here. The difference is one of what they have, not of what they know and not of what they need. And I think it's great if we can help them get their supplies and solve their ostomy issues on a regular basis and get more nurses to do this kind of care. It excites me to have been able to meet her. and to be able to help her in sending supplies.
It was an extremely rewarding experience meeting her and explaining to her that through the email that it's going to be very expensive to send these, and we're going to be in the vicinity anyway. Maybe we could figure out how to develop a trip and head to Nepal. And we were able to do that, just like you said, with, we added on a nursing education program at the Patton General Hospital, which is about 350 beds located in Kathmandu. Dr. Arun is a medical oncologist, the first medical oncologist in Nepal. And he was someone that I met when he was finishing his residency at the National Cancer Institute in Bangladesh, where we have provided education and training for 3 years prior to COVID. So it was a really great fit. We had an incredible opportunity to meet more people, to create more contacts and contacts that were interested in containers, and having us come back for a much longer medical mission, something where we could bring surgeons and bring other nurses and nurse educators. So stay tuned, because the next time we go to Nepal, it will probably be a 10-day to 2-week trip for a medical mission. And then people could stay longer and go off and go trekking or whatever they might like to do. It's a very much smaller country, 29 million people compared to, or around 30 million people compared to 180 million people in Bangladesh. So it's not as noisy and it's not as crowded. So it's a little less stressful at times. So we had an incredible experience up there, and we will definitely keep in touch with this nurse and be able to provide her with ostomy supplies in the future. So thank you for doing that, Francine. It was a
My
great
pleasure.
time.
It was a great
It
time.
was a really great time. Wouldn't you say, Marietta?
It was really a beautiful experience for all of us. It's incredible how these people appreciated everything that we do, and they're looking forward for us to come back.
Yeah, definitely. Thank you. Okay, so now we want to talk a little bit about the history of nursing education in Bangladesh. I'm going to turn it over to Suzanne.
Okay, well, thank you very much. And I learned the history actually from meeting with the civil surgeon. So it sort of ties into the second slide as well with our meeting. So as Elizabeth said, this trip was packed. So we got settled in like Saturday afternoon, and the very next morning we're off to the nursing school. The name of it is Sheikh Hasina Medical University College of Nursing. And it's in Tangail City. And just to give you a little background, Sheikh Hasina Wazed is the Prime Minister of Bangladesh, and she promised the people of Tangail, as well as 5 other geographic locations, that she would build a government-financed medical college to help increase the number of doctors and nurses to serve the people of Bangladesh. And so the Sheikh Hasina Medical Center in Tangail is the 24th public government-sponsored medical center. The people in Bangladesh are incredibly friendly. I think we all know that, very welcoming. And so it was no different here at the school. We were greeted very warmly with administration, faculty, as well as students. And our very first meeting was with Dr. Khan, which is on the next slide, but you can see who is a civil, to show a picture of him. Is that, oh yes, there's our meeting. You see his back, I'm sorry. He's the civil surgeon of the medical college, and he started us off. He gave us like a brief historical development of the Bangladesh Nursing and Midwifery Council. We'll call it the BNMC, right? This is the regulatory body for which all activities related to nursing are managed, things like best practices, as well as nursing education. And Dr. Khan, he gave us a little history on Bangladesh too, the Liberation War in 1971, how Bangladesh won their independence from Pakistan. And post-liberation in 1977 is when the BNMC came into fruition, as well as the Directorate of Nursing Services is what they call it. This was under the Ministry of Health and Family Welfare Division. So one of the things that Victoria does is to help the BNMC to align their goals with the national goals. So for example, we have Healthy People 2030 that we have our national goals. And so one of their biggest goals there is health for all, regardless of socioeconomic status, gender, religion, age. And so the two of these agencies work together to help achieve that. And so as a result of some of these changes, the nursing profession in Bangladesh has increased in numbers to a more sustainable level. But they still have a ways to go. So if we could just go back one slide, Elizabeth, sorry. Okay. So the entry into practice is a basic diploma certificate. And the students engage in, of course, classroom, didactic, lab, simulation, as well as clinical experience. And they go to school 45 weeks out of the year for 3 years. So that's almost year round. They get a few weeks off. And the nursing uniform, as you can see in the picture, it's this olive green color. And nursing students are distinguished by year by the color of the sash. And so in these pictures, you can see, I could tell on the right that that's a senior level student because she has a red sash. First year wear the hunter green belts, second are orange. And then faculty also wear the same uniforms too. Well, they have a royal blue belt. So if you're a nursing supervisor, faculty, instructor, or any in a position of authority, you'll have a royal blue belt, which is interesting. And what's not in this picture, they also have uniforms for the midwifery program as well. And those are light pink in color as well. So admission is 12th grade certificate, but one of the fastest growing programs in Bangladesh is a post-basic education in which nursing students can gain a Bachelor of Science in Nursing or a Bachelor of Science in Public Health Nursing. And this is affiliated and sponsored by the University of Dhaka, which is the largest public university in Bangladesh. So unfortunately, that was my only day there. And so Marietta and Colleen, if you want to share your experiences teaching in the nursing school.
Well, I'll start off because in one situation here where you can see me, we did a presentation on breast cancer awareness and teaching people about self-breast exam. And these are actually prostheses that people that have had mastectomies here in this country would wear in bra, and we don't send those in our containers because they would never be used. It's not part of many countries' culture. And so we use them as models to teach students and other healthcare professionals how to do a self-breast exam. And so that's one of our biggest programs that we have implemented several times at the National Institute for Cancer and Research. And just to give you an idea of what the hospital looks like, as you can see over here on the left, you have dirty mats that are not changed with patients. The patients have to bring in their own linen to make up these beds. And as you can see, you have a rusty metal bed. And you can also see patients that are lined up in the hallway. So when you have 350 beds at Tangail General Hospital, there are 450 patients. So the other 100 are everywhere in the building and on the floor, in the hallways with their mats that they brought in. And they could be having their IV therapy there or their wound care there or be there for a variety of different reasons. So the challenges are great, really great compared to what we have here in this country. Marietta and I and Francine and Annie were all involved with presenting different programs as part of our educational opportunities that we offer. We have a vast number of PowerPoint presentations that a variety of nurses have developed over the last several years for Partners for World Health. And we're always looking for other nurses and nursing colleagues that would be interested in participating in nursing education, because our focus with that is to help improve the standard of practice so that everybody's health can improve down the road. So it's really important to provide this education. And as Suzanne said, they're like sponges. They're so excited to have you there and to listen and to learn. Marietta, you were an incredible teacher.
Oh, well, so I had actually a couple of groups of teaching. One was in the morning, one was in the afternoon. The first group was rather large, I think at least 30 students, pretty much on like freshmen, I believe, and some senior and some junior, also a few midwives in the class. And you could tell in their eyes that they're really trying to absorb everything. And I covered hypertension, and I also covered cervical cancer, and also post-op care. So interesting enough that because they're so attentive, they ask questions that are so appropriate, and I'm so happy about that. On the post-op care, we focus on prevention of complication. And some of them are seniors and has a better understanding, but you could tell that the freshmen really like sponges, little sponges. The interesting question was, are you coming back? They really wanted us to continue education. So after the lecture in room, later this afternoon, we had a chance to go to the hospital, which is really good because we could follow up what we discussed, like Francine covered the wound care. So we're able to see patient with wound and able to do the hands-on, which is, I tried to explain to them that every nurse perhaps might have our own technique, but the philosophy is the same. So I give the example that we all like two of us were gonna go to Nepal. I could take a bus and she could take a plane and we'll get to the same place. It's basically how I explain it and they get it. So it really, we focus on prevention of infection, hand washing. We gone to history, we gone to what kind of wound, different kinds of wound. And that was very interesting for them because they thought every wound was pressure sore. So when I explained to them that there are certain wounds, surgical wound, burn wound, the pressure sore wound, and their eyes are all lit up, which is great. And you know they're listening, you know they're learning. So to summarize the whole thing is it's really worth it to go across the country because you know they needed education and you know they appreciate everything you do. And for me, it's very rewarding to all that hard work. And you know that too, because they will ask, are you coming back next year? So I kind of sign it and I say, yes, I will. So we will continue the education next trip.
Thank you, Marietta. And yes, we have been providing, excuse me, education and training at Tangail General Hospital actually for several years. So it is part of our mission in Bangladesh. And Colleen is also here. And Colleen was involved with presenting and teaching PowerPoints focused on communication. So Colleen, would you like to share your thoughts?
Can you hear me okay?
Yes.
Okay. Yeah, I really enjoyed, doing the education in both Bangladesh and Nepal. My education piece is focused on a diabetes review and on an effective communication or an enhanced standardized communication for nurses to use with each other and with physicians when they're passing on information during report or calling physicians to ask for orders. And other things, when the physicians are not on the premises. And they were so receptive to the education. The diabetes review went very well. They really were attentive. Like Marietta said, they wanted to know when we were coming back. They couldn't get enough of education. They appreciated, they had good questions, and they discussed with me after the communication piece and how good it was to see a system for organizing their thoughts before they made a call to a physician, for organizing their thoughts, for giving report so that they didn't leave information out. It was just really felt good to see the information being absorbed and appreciated by the nurses.
That's great. Thank you, Colleen. So we want to move on now to our brothel, our primary care services in the brothel. Okay, so as I mentioned earlier, the last time that we visited the Kandapara brothel was in March of 2019. And to give you a little history, I did have the opportunity to visit 3 other brothels in Bangladesh over the years. One of them in particular had about 3,000 sex workers in this space with all of their children. And as I walked around and was introduced to different people there, I met a lot of organizations that were there, like UNICEF and some other major NGOs that were really supporting the women and supporting the children, especially the children. In fact, they created a system in some of the larger brothels where they would take the children and put them in school and they would live outside. And then when they turned 18, they could make a decision as to whether or not they wanted to go back into the brothel to live with their mother, or hopefully being encouraged to continue with school or get a job. But many times these girls ended up returning to the brothel. The difference was that in Kandapara brothel in Tangail, they really didn't have a lot of support or a lot of other NGOs that were there to help with children or to provide primary care services or to provide any sort of education. So I decided that this would be the one that we would make our commitment to. So we've been going back there every year until March of 2019, which was the last time, to provide primary care services. And just to, this is an example of a madam's house. This lady on the left is one of the 11 madams that they have in the Kandapara brothel. And the madams are women that are elected by the sex workers to be like the managers of the brothel. They have been sex workers. Many of them have been born in the brothel and they've grown up in the brothel and they've stayed. They've made a lot of money. They're able to have a larger little house, as you can see here. She has a lot of things and a refrigerator and dishes and fans and a big bed, and she's really in a fairly decent situation in the brothel. And if you look on the other side, this brothel is about the size of a football field, and they have these little alleyways, and you go down these alleyways and they have these little doors and these little rooms that are probably about the size of one of our bathrooms here in our country, where there's a bed and their belongings. And each woman has their own area for which they have to pay for. I might add, they have to pay rent to the madams who are organizing this and collecting money for the rent. And they also have to pay electricity. So there's a lot going on in a brothel. And for example, here, and so we'll talk a little bit about the history. And Suzanne is going to chat a little bit about what happened with some of the trafficking laws and some of the history of what happened to them back in 2014 or 2015. Yeah.
Yes. So I was interviewing one of the ladies, and she kept saying, well, in 2014, when the brothel broke, and I thought that was interesting, and I asked the interpreter, what does that mean? And we had to ask the police that were there as acting as security. And he said in 2012, the Prevention and Suppression of Human Trafficking Act passed in Parliament, basically criminalizing sex and labor trafficking. And this allowed prosecution of traffickers from 5 years to life, as well as a fine of $50,000, which is about $590 US. So even though it passed in 2012, the raid on the brothel did not happen until 2014, in which they made everybody leave. And so when the ladies referred to the brothel being broke, they meant during that time. And so while prostitution is legal, now trafficking is illegal, which I think they don't have as many young children sold into the brothel after 2014.
But you will listen, you will also hear in the stories from many of the sex workers that they were actually trafficked in. And they may have been a street child sitting on the side of the road and they were hungry and someone came up to them and said, I can give you your dinner. And then they go with this person and they end up in the brothel and they're sold to the madam in the brothel who feeds them and takes care of them, but then becomes very abusive in the process and threatening them and telling them that they can never go home because their parents are no longer around, and creating all these incredible stories. And then eventually putting them in the sex industry at the age of 13, 12, 13, or 14. And when I first went to this particular brothel, I remember seeing some of these young girls, and there still are several young girls that are under the ages of 18, 15 years old in the brothel as sex workers. So when the sex workers had to leave the brothel, they actually got together with an attorney, and it was found that what the landlord had done, because the landlord owns all of the land and everybody else lives there and rents and pays the rent to the madam who's probably paying rent to the landlord, that what he did was illegal. So all of them were allowed to come back. Many of them did come back, but some of them stayed where they were in other brothels. Some of them may have gone back to where they were from originally. But a lot of the people that may have been trafficked in from Nepal, from India, from other places in Bangladesh, remained and came back to live and create their lives again in the Kandapara brothel. There, as Suzanne mentioned, it's a legalized profession in Bangladesh, and that has always struck me as kind of humorous in a way, considering it's a 95% Islamic country that has arranged marriages, and of course wanting a girl to be a virgin on the wedding night, and here we are having a legalized profession of sex work. And what happens with a population like this is if they enter the brothel and they start in this, they may go to school when they're younger, like 7, 8, and 9. But then when they start the sex industry, they don't go to school anymore. So they don't know how to read or write in many instances. They know no other life. They would not be able to leave the brothel and go off and start another profession or start a new job. And one instance for one girl that I met there, she was married by her family off to a man who beat her and was also a drug addict. And she finally left and she tried to do it on her own in the local villages and she couldn't make it. So that's how she ended up in the brothel. So many very unique and sad stories that some of us will share this evening that we were able to obtain by talking to many of the people in the brothel. This lady on the left is this incredible dancer, and with a smile that was beyond belief and so much energy, and full of energy and vim and vigor, just an incredible person. And the lady on the right, which we will talk about close to the end, is a sister. She's one of 3 sisters that are sex workers in the brothel. So we want to talk a little bit about the work that Suzanne did through USM on this research project. And so I'll turn this over to Suzanne.
Yeah, thank you. I conducted a project. It's called the Phenomenological Exploration of Lived Experiences of Female Sex Workers in a Bangladesh Brothel. That's a real mouthful. But basically, it is based on descriptive phenomenology, which is interested in the lived experiences. So it has to do with intuiting, analyzing, describing, not just what the people say, but their body language, the environment they live in, how they interact with each other. So initially, I always get stressed out, and I went to Elizabeth. I said, what if nobody wants to talk to me? Then all this, time and effort. And I told her I needed 15 people. And when I got there, of course, Elizabeth drummed up all these people waiting in line to talk to me, which is wonderful. So I ended up with about 25 interviews. And it turns out that people were very interested in telling their story. And it was a wonderful experience. And on the left, this is a picture of my interpreter, Badia Rachman, who was absolutely wonderful. I don't know if she was in the first picture, but I would give out, she was a phenomenal interpreter.
Yes, and she also just graduated from medical school, I think.
Yeah.
Yeah. And she's going on to her internship program and then on to a specialty. It's not like here in this country where you can pick the specialty that you might want to do, like you want to be an orthopedic surgeon or an OB-GYN physician. You have to qualify, and you have to find if there's a slot for that, then maybe you might be able to apply and be accepted. So it's very, very different here compared to what it's like in Bangladesh. So we also provided primary health care, and when Suzanne interviewed her 25 people, it took about a half hour or
Almost an hour per person.
okay,
Yeah, it was-
almost about an hour to gather all this data. And remember, we don't speak the language, so everything has to be translated, and then the interpreter has to translate it back to us. And that's the same when you implement a primary care service in some of these developing countries. So they went through that program or that interview process, and then they also wanted to be seen by the provider and go through the additional questions for to give us their general health complaint and other health issues. And Partners for World Health developed a form for gathering information for physical exam, but also a social issues to gather information about social issues, like do they have enough water, do they have enough food, and what are their concerns in the brothel. So we have all of that data that we will give to an intern more than likely sometime this summer, which would be a great project for an intern actually to pull that all together and really analyze that. And so the way this process would work is that they would come in and be assigned to a provider. Here in this case, Annie over here on the right, and an interpreter, and they would fill out that form, and then they would wait in line until they were able to go in to see the provider, who is on the left side of the picture of Marietta. And Partners for World Health brings for its primary care mission all of the necessary oral medications and creams and hand lotions and that different types of antibiotics if necessary. We also have a glucometer there, and we make sure we take their vital signs and monitor blood pressures, especially if they're extremely high. And we've had incidences in the past where they've been very high to the point of needing to go to the hospital, which we've also been able to transport these people if necessary. And so they eventually come in to see the provider, and the provider goes through the health assessment, and most of the complaints, which I think I'll let Marietta comment about because she did most of provided most of the treatments for these individuals. So Marietta, what were the general complaints that you would think of that occurred?
It's mostly they share the same issues, because I think it explains a lot because of the country being hot and the air pollution and allergies. And so the complaint would be like breathing. They cook outside with an open fire, or a lot of itching. And then when those complain, then you check where does it itch. And then most of the time I'll see like fungus on their toes, in between their toes, or yeast under the breast and the groin area. And it's because they are a sex worker. So you really have to explore that a little bit, that it's not really transmitted sex disease. And so come to find out mostly.
Back and forth when it comes to COVID. Remember Title 42.
But someone-
emergency authorization under COVID. So they were
See,
going to
I
wipe
think
that.
that-
Fauci saying the pandemic phase is over, and yet the administration is fighting the mask mandate. To hear Secretary Pete talk about it, because they want the authority to be able to mandate masks in the future. But then they're going to the White House Correspondents'
If it is
Dinner, including
option.
President Fauci's not. You know, it's just a bunch of
There we go,
Okay,
Vincent.
okay. Sorry about that. If everyone could mute themselves, that would be helpful. Or just be quiet for a few more minutes. Okay, so yes, I think Marietta is right. There were a lot of those kinds of challenges, and there were aches and pains and
Yes.
back pain and shoulder pain. What did you say?
Yeah,
Yeah.
and so the medication that we have really are friendly medication. And you know, we have Nystatin ointments that we could give to these people that is yeast. We also have some ointment for the fungal infection,
Pain medication.
and pain medication for the aches and pains, depending where the aches, when it aches. And so we have Tylenol, we have ibuprofen. Well, we do have a lot of reflux acid because of the food they eat and the spices and how much they eat. So you always have to end it giving antacid, which is like the tablets, the local, what do we have, Elizabeth? I can't remember now.
Like Zantac,
Yeah, we do give that, and then with Tylenol,
omeprazole.
omeprazole, and then put in some ibuprofen.
Yeah.
Another pain that they have is related to like some tingling in the legs, but they're young. So a lot of these people are actually has vitamin deficiency. So we have a lot of multivites. So those are very commonly given to them, and vitamins, multivites, some calcium. So now taking these meds, you have to get education to these people. So the interpreter are physicians, so we're sort of on the same page. But because a lot of these patients are illiterate, can't write, can't read, so that kind of a challenge. So I have this thing of like, tell her, and then I want her to tell me at least 3 times until she get it. When she get it, with the food or without a food, what time of the day she gets it. And that is like, if it's, she could tell me 3 times, and I know, I feel good that she could go home and take them.
Right, so part of our role in this primary care mode is to really provide education for the patient, because they don't have the opportunity to learn or listen to anybody. No one takes the time to listen. And I think that, and we also realized that there's also mental health issues in the brothel. A lot of people come in and they look extremely depressed. They're young, they're crying in some instances. So Annie, would you like to talk a few minutes on some of the mental health issues in the brothel?
Yes. So my name is Annie. I'm a licensed social worker, and I also have a license as a mental health rehabilitation technician. And that allows me to develop treatment plans for people and to kind of move them to success and recovery. Going to Bangladesh was interesting from my perspective, because it's very different there than it is here. Here, we're very much in tune with mental health and mental illness. We have a plethora of mental health supports, providers. We very much medicate mental illness in this country. And as I was doing my research before I went to Bangladesh, I found that although mental illness is seen as typically as though you are possessed by evil spirits, they have one of the highest suicide rates in the country. And in fact, I think I read in 2020, they had more suicide deaths than they had COVID deaths. So that's a pretty big discrepancy from, the importance of it based on the attention they give to it. I also did a lot of research and found that they have a lot of psychiatrists, but not a lot of social workers. And social workers are kind of the ones that get things done. And psychiatrists are amazing, but social work is more task motivated, helping people move through conflict and to make positive changes in their lives. So, here we have a lot of social workers, but not a lot of psychiatrists. So the system is very different than it is here in the US. I did spend a day doing a presentation in the hospital to the nurses, and I needed to kind of understand where people's understanding of mental illness was. And so the first thing I did when I went in was I asked everybody to go around the room, and I think I said there was about 40 people in the room, and give me the first word that comes to their mind describing mental illness. And every single person but one, the first word that came to their mind was sad. I had one person say, mental illness is worrying a lot. So depression or anxiety basically is what they recognized as being part of mental illness. I then went around the room again and asked what the first thought is around how to treat that. And the three common answers I got was have a cup of tea, eat something, and take a nap. So, obviously that's very different approach where Americans, there's a medical model and we use medication to treat that. And it's very, very different. So back in the brothel, I think I was there for 4 of the days, and on average, I think I was doing about 15 to 19 interviews a day. So I can only speak to my experience and the women that I interviewed. But what I did see was there was a lot of trauma, obviously, and a lot of shame about being where they were. Many of them told the story, like Elizabeth mentioned, about, I was 12, I was out with my girlfriend, we were picking flowers, and I turned my back to go pick another flower, and my girlfriend was gone, or somebody came up to me and took me. Or my uncle said we were going to the store and he dropped me at the brothel. And I think the average age for those women were between like 9 and 12. And some before their periods, some before they even, technically started menstruating. So, and a lot of them did say, when I asked them, well, why didn't you leave? Or did you think about leaving? They would say, no, they told me people were watching me. They told me I wouldn't get 5 feet down the road. Someone would hurt me. They didn't give me food. They said if I even tried it, they would beat me. So that, that was a lot of what I experienced from the women's stories. We used motivational interviewing techniques to try to determine what level of change that the women were at. So it was basically a rating scale where they definitely had from, I don't want to change, to I'm ready to change right now, help me. And so I think we were able to get some good data around that as well. I think of what else was.
Well, that's a very, very good point about the motivation level,
Mhm.
because there are some people in the brothel that would like to leave, but they don't have any opportunity and they don't have help in order to get out of the brothel. And yet there are also some that they've been there for so long that they cannot imagine doing anything else. Or they're much older now and they're willing to just stay and live out the rest of their life in the brothel. So it's really, we did gather that data when we analyzed it. It'll be really interesting to see which ones are interested in leaving and which ones want to stay. And we see these people on a regular basis. And what we did this time when we arrived in the brothel is that we had a big tour and the madams took us around and showed us around. And we had photographs. I had photographs of many of the sex workers from the past. And I showed them the photograph. And I wanted to find all of these people. And we actually were able to find most of them that we had seen in the past. So it was a really wonderful welcoming moment for them to see us. And we apologized, at least I apologized numerous times that I'm really sorry we just couldn't come back here because of COVID. And they were so, it was very interesting because they smiled and they said that was okay. We totally understand that, but we knew you would be back. We knew you would come back. And that's one of the things that Partners for World Health does. We make a commitment to something and we stick with it. And we show them what we're doing and that we are committed to it. The whole BBC, the blue button of commitment. You make a commitment to something, you make a commitment to someone, and you show up again and again and again. So that welcoming feeling said to me, we're on the right road. We're definitely on the right road at the Bangladesh brothel. So we want to talk a little bit about each of our own experiences on, what really affected most of us when we were there. There's always one person or one or two people that you speak to, that you develop a fondness for, or a story that you could never possibly have imagined if you were still here in the United States, because they are so unique. And so we will start with Suzanne. Maybe you could tell a little story about this lady, or not necessarily about this lady, because this lady is actually one of the madams in the brothel here, and very warm and friendly and a delightful lady. But there may be some other unique story that each of you may have had. We wanted to pull different photographs so you could see everybody in action here.
I've been thinking about this since we talked about it last week, that it's so hard to think of one story. But I think I've narrowed it down with my interpreter. We were recording, and this one woman, she didn't make good eye contact. She looked down, and I said, what's one thing that you could wish for in your life? And she said, I want to buy a big house, which I thought was kind of odd. And I said, really? Why do you want a big house? And she looked at me dead in the eye and she said, so God knows that I exist. And I had to shut off the recorder, and both the interpreter and I, we had to take a break because we were just, it was like this existential crisis.
Yeah. Very thoughtful. Yeah, one that kind of hits you right in the chest and you don't really know what to say, because you never would have expected that answer.
Can I just add that at the brothel, there's a temple, and which the sex workers can use to worship Allah and pray to Allah. And while we were there, there was at Ramadan started, there was some holy day while we were there, and their religion matters to them, and many of the women, like Annie said, also said to me that they felt shameful for the work that they did. And they also, I think, felt ignored by Allah for not being able to get out. But I just wanted to add that.
Yeah. So, Colleen, What are your thoughts?
One of the things that I learned and that struck me while I was there, I knew that through our interviews and talking with the women, I knew that there were women that lived at the brothel who became pregnant and kept their children, and that hoping for a girl was actually a thing, that they would hope for a girl and they would raise her and they would start her doing sex work, start their own daughters doing sex work when they were old enough, which was generally around, 12 or 13. And I wondered, how could somebody do that or want that for their own daughter? I wasn't able to understand that. And as I got to know the women more and talk with them more, I began to understand that these women, when they hit middle age, they were their earning capacity diminished, and eventually dried up completely, and they were unable to support themselves in any way. They still had to pay for rent, they still had to pay for food. And once their earning capacity was reduced to a certain level, they had no way to support themselves, and they would need these daughters to support them. And looking at that whole picture, I saw why it made sense to them. And, it was just so bleak that you would have to put your daughter in that position. But they had they couldn't leave. They had no training or education. Many of them had been in the brothel since they were 9, 10, 12 years old. So they had no education or training, no marketable skills. So, they were destined to spend their lives in the brothel. So that's what struck me, is just what a cycle it was.
Yes, it's very typical for, if boys are born in the brothel, they end up going to school and maybe getting a job. But most of the sex workers are hoping, if they do get pregnant, and most of them don't want to be pregnant, because no mother anywhere in the world wants their daughter to end up as a sex worker. But as a sex worker in Bangladesh, if you do have a girl, it's like your retirement package, because that little girl is making the money so you can eat and sleep and take care of yourself. So it's a very sad situation, because there's no way out. Thank you, Colleen. Annie.
Oh,
I love this one.
Yeah. This was,
Um,
yes, oh, yeah, tell her about this story, because I've known this young girl for a long time, this girl.
Is she the one with the brain tumor?
No,
No.
no, but you can share any story you'd like.
Yeah, I interviewed this woman and she was lovely. And I will say something about her. Before I went to Bangladesh, a lot of, people would be, they'd be like, that's going to be so hard. How can you do that? It's going to be difficult. Are you ready for it? And when I look at this picture and I look at that woman, I have never met such fierce and resilient and joyful women in all my life. The level, so there is hardship and trauma, but I also saw women dancing, and we saw girlfriends combing each other's hair and playing cards and cooking for each other. And, there was an incredible amount of love and dignity within the brothel, perhaps not from the people who go to the brothel. And I'm sure that there are, hierarchies and conflict and discourse, but I saw a lot of love and a lot of just amazingly strong women. And I'll just segue into the next story. I interviewed a woman. She was 19 years old. She had a babu, which is similar to a pimp. Is that what we would call that, Elizabeth? Similar?
It's more like a special boyfriend. They're not really pimps, it's their special guy that comes to see them all the time, and has a relationship with them, even though they may be married and on the outside, and they help to support them.
So she was 19, as I mentioned, and gorgeous. And she was in love with her babu. And she found out that she had a brain tumor. So she came to the brothel to make money to pay for the brain tumor. She was told at the doctors that it would take $50,000 and that she would have to go to India to get the
50,000.
surgery. I thought she said, yeah, I think it was 50, it's brain surgery. So, so she was at the brothel to make money to have that surgery. And so as we started talking about this, my interpreter, Sultana, and I started talking about, well, what do you do for someone like that? How do you get her help? And within 20 minutes, Elizabeth, myself, Sultana, this beautiful woman, and Joy, who was a member of the Pathfinders, all came up with a plan on how to get her evaluated. And the Pathfinders committed to helping her get that surgery. They thought that they could get the surgery within Bangladesh and not have to leave. But within 20 minutes, this woman's life radically changed into a very different direction, because we were able to hear her and think outside the box and get everybody together to, just brainstorm and find a solution for this beautiful woman. And so I hope next year when we go back, she is not there. And I hope, I have kept in touch with Sultana, the interpreter, and she's been checking on her. So there's follow-up on in Bangladesh, actually, reaching out to this woman. We exchanged contact numbers. So my hope is that her life moves in a very different direction.
And the Pathfinders group that Annie is referring to is the Rotarian group in Tangail, actually in Dhaka. And there are many, many Rotarian groups throughout Bangladesh, just as there are all over the world. And you cannot go anywhere and participate in any medical mission unless you have a contact. And that's what we have developed over time. Every country where we go, some of them are Rotarian contacts, like in Bangladesh, and others are individuals that we have worked with or that I have met over time in a variety of hospitals in the healthcare arena. So Joy is is a take charge guy that can always figure out a solution for something. So it's one of those things that it just was meant to be. It was meant that we were supposed to go back there this time, and these certain people show up in the brothel to seek service, and then we were able to help them. So that's a great story. Francine.
Well, I have to pick up on what Annie said and tell you that, excuse me, this is my spring allergy, I apologize. The women who were at the brothel all had such a positive attitude. And this was true about the Bangladeshi people in general. They were happy people and they seemed to live in the moment. They found joy in just being together and celebrating, talking with each other and laughing and singing. And the women had that aspect to them. Even though I also had different individuals who had sadness and had some sad stories of how they got to the brothel or how things were going at the brothel. All of them, or most of them, believed that they would be able to get out, that they would be able to make money, and that they were putting money aside, and that they had a plan for getting out. One woman even said she was from the outskirts in the rural area of Bangladesh, and it was far north of here, and nobody knew what she did down here, but she was making money. And when she had enough money to buy a goat, she was going to go back because she had a place to live where she came from. She was going to go back there, buy her goat, and she could sell milk, fresh goat milk, and make a living off that. And that was her plan. And I wondered if that was a real dream or if it's a possibility, I don't know. But I too would like to not see her when I return next year. But my biggest thing that had the biggest effect on me was not the women, because I saw their strength and their support of each other and their friendship. And on some level, they're comforting each other. When our last day there, we gave out beanie babies to the children. We gave out clothes. And we were all helping and doing that together. And one woman was holding about a 7-month-old infant in her arms. And when we gave the mother a beanie baby and she held it to the baby, and the baby's face lit up, the eyes open, the mouth open, and it was the biggest grin I had ever seen. And he just reached for this toy and took it. And I have never And all my grandchildren or children have seen such joy on a child's face for an object, for a toy. And it upset me enough that I just had to go. And that was when I shed tears for the whole experience, because they do so much with so little over there that we can learn from them just as we teach them.
I'm pretty sure there were tears everywhere between us
Yeah.
at one point or another.
Yeah, it's not
It was very intense.
it's not a place that you just go in and have a smiling,
right.
happy day. There's plenty of amazement and sadness, because our lives are so different here, so different. Marietta,
Well,
what has affected you most in the brothel?
I actually would like to cry now, but anyway.
It's okay.
It's a
Go
lot,
ahead.
it's a lot of tears. However, before coming to the brothel, I just don't have any idea. And I guess I would like to go there with not knowing at the same time, because I want to discover it myself. Because when you hear in the society about sex workers, sex trafficking, all this, it's all dark. It's all stigma, negativity, or pretty much a stereotype. Well, she deserve it or whatever. When I got there, that wasn't the story. The story is the same, very sad, very, very sad. And most of them, it's not their choice. And looking at this woman, trusting us to be there and accepted us, I feel like they're women like me, and how lucky I am to be in this position. And what could I do for them? To be there every day, to interview them every day and give them hope. Do our primary, give them, like, they are accepted, because they are, for me, they are their own community. They have their own a circle of women in the same situation. And every day we come, I regain energy and more love and more hope for them. And I think I learned so much from them. I learned so much about humanity, that we are not also lucky. And we share tears, we embrace. Sometimes we have to take ourselves out and we just hug, and that just keep us going.
So, okay.
I love this woman.
I do too. Look at the love.
So this is my story of a lady that I have known for several years. And I took this picture, someone took this picture of her with me in 2019. She was born in the brothel. She grew up in the brothel. She has two children that are also, one is a boy, one is a girl that is a sex worker, and she has two grandchildren. And now she's probably in her early 70s or late 60s, but she's led a really, really hard life. And one of the things in 2019 that she was telling me about is I try to do things around the brothel so that people will share a little bit of food with me, because she's not able to make any money. So she has her daughter that gives her some things, but her biggest challenge is food. So they took this picture, and then I brought the picture back in 2022 because I wanted to see if she was still there and could I find her. And they saw the picture, the other people saw the picture and said that she was still living and she was here. And she is the lady in the photo on the left in 2022 that is responsible for cleaning the little courtyard where the temple was. Where our space was is in this little courtyard, and she's the one responsible for keeping it clean as part of her job, and probably earns a few taka for that service that she provides. But the issue that I want to bring up is the fact that these elderly people have nowhere to go. And there's no one there taking responsibility for them or taking care of them. And many of them don't have a daughter that might be continue in the sex industry. So part of what Partners for World Health wants to do down the road is how can we create a place within the brothel, and there is land in the brothel where some of the elderly people who don't have appropriate housing, who don't have enough food, can come and live within the brothel. And that's something that we discussed with the Tangail Rotary Group and invited them to come down to have a tour of the brothel. These are people that had spent their whole life in Tangail and they've never been inside the brothel. And one gentleman did come down and listen very seriously about some of these challenges that we presented about the elderly and about the children and the sex workers. So we've had some incredible emotional experiences when we're there, and the connections to see the same people the following year is really so heart provoking. It's just, it just brings tears to your eyes to see them again. And the big thing that they get is that they remember us and they're glad to see us again, because we have made a commitment to them and we have decided to go back every year. And so we welcome you to join us on that mission. In fact, there is one nurse on this call tonight, Janine Gorman. Are you there, Janine? Janine is a nurse practitioner and she was there with us in 2019 and met several of these women that we have shared this story, part of our story. Whoops. Sorry. Janine, would you like to share a few words?
Well, pretty much what everyone had to say, I experienced too, or felt with the women at that brothel, and you never forget them, and I'll never forget them. Just their stories, and as what everyone else has spoken about, you know, just the things you saw that you think, oh, dear God, this could never happen in our country. You know, woman came, a sex worker came with a baby, an infant. It was probably 4 weeks old. I don't know how old, but the infant was extremely dehydrated and ill, extremely flaccid. And the woman came out begging, my baby's sick, help, 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 my baby's sick. And then she went away. She said she had a customer. And then we came, the day we left, we came back and she was on the sidewalk. Same thing, my baby's sick, my baby's sick. And so I'm sure that infant died very soon after that. And I thought, you know, the things we do in this country to keep infant babies alive, and to see something like that is really shocking. So you do never forget those women. And I do pray that God will see them.
Thank you, Janine. So in closing, we want to talk a little bit about what Partners for Growth is planning on doing. We started discussing this back in 18 and 19, and it's called the Rising Up Project. And in 2019, over the years, but in 2019, we identified 4 women that are very interested in coming out of the brothel and starting a new life. And the picture on the right are 3 sisters that were all born in the brothel. Their mother died with a drug overdose. Obviously 3 different fathers, but 3 sisters. And the older one wants to leave and has wanted to leave for many years, but she won't leave because she doesn't want to leave her sisters behind. And when we had this discussion about how we might develop a program where the individuals could commit to a change in their alternative lifestyle, they were very interested in becoming involved with this. Mooney on the left is also another woman that is interested in becoming involved in our program. All of them were born in the brothel. The lady in the middle of the 3 sisters has a young child that I think is 5 or 6 years old now. And so we've been talking to them about what this program would look like. We identified these people in 2019, and we were going back there in 2020 to work with the Pathfinders, the Rotary Group, and some other colleagues in Dhaka to set up a program where we would offer them a place to live about 25 to 30 miles away from the brothel, away from Tangail, because if you move back into Tangail, people would know that they were sex workers and they would still have the challenges of being known as a sex worker. So they need to be able to live somewhere else. And then live somewhere else, provide an education on how to read and write and to learn a skill. And one of the skills that we are interested in doing is to collect all the recycled, all the saris that are recycled numerous times by many of the wealthy people. They buy a sari, they wear it 2 or 3 times, and then they don't wear it anymore. So there's a huge amount of fabric that's available. And we could recycle that, which definitely supports the mission of Partners for World Health in terms of our sustainability and protecting our environment, and then making, after designs developed by individuals in our Western world, and make some of these items, teach them how to make these items out of recycled fabric, and then sell them to the Western world through an online basis, and then use that money that we would generate from that, help to support the project that's going on in Bangladesh, sell more items, and then be able to take another group of people out of the brothel the following year. Now, these women that you see here owe nothing to the madams. They don't have any debt. They aren't paying off anything. Whatever they had to pay off has been paid off a long time ago, and they are free to go. But the only way they can go is if an organization like Partners for World Health were able to set up a program for them to participate in. And that's the challenge, because how many organizations show up at a brothel to provide primary health care? Not many. In fact, we're the only one that I know of that does that in the Kandapara brothel. So this is what we hope to do in the future. And we have connected with some very strong women in Dhaka, Bangladesh, that are very supportive of this project. And they actually, 2 of them came with us this time, spent a day with us in the brothel to listen to these stories, to walk into the brothel, to see the way women were living, and are extremely supportive of being involved with this project. And most recently, I met a young man who has designed 2 huge bags out of blue wrap that will be in our Blue Wrap Project Runway show on May 19th. And I talked to him about this. He's in the bag design business, and he's very interested in the design part of this and would be willing to provide education and training. So now we're looking at how could we develop a grant? Where could we find some grant money and also some donation money that would help us set up this project? So stay tuned, because the Rising Up project is definitely something we want to do to be able to help these women at the Kandapara brothel. Want to wrap this up, but also ask a lot of people have the opportunity to ask questions. But before I do that, I just want to share with you that we have medical missions coming up in May. We have a medical mission departing on May 22nd to Senegal. This is another place where we haven't been back to since May of 2019. And we are looking for nurses and other healthcare providers. We're taking 6 students with us from the University of Maine in Orono, and we'll provide primary care, wound care, and Project 10,000, which is to provide education and training to pregnant women. And we'll carry with us about 400 birthing kits that we actually make here at Partners of World Health, everything that a midwife needs to do a normal delivery. And so after that interview and education, each woman will be given their own birthing kit to take to their midwife when they go into labor. We have another medical mission in Liberia, leaves early June, around June 4th, and that is primary care, wound care, again, Project 10,000, but it's a special group of people that live in the eastern part of Liberia, in a city called Ganta, about 100,000 people, excuse me, and 10,000 of them have leprosy. I didn't realize until we shipped a container to this hospital, the Ganta Rehabilitation Hospital, that they are also caring for 10,000 people with leprosy. So we're going to provide wound care and education and training. In August, we're planning on going to Kenya, to the western part of Kenya. We have a partner in New Hampshire where she's been there a few times to do, to provide services at a small hospital there, and we've sent them a container. Part of our program and our container programs is that we try to provide a medical mission and follow up in the future. So we're hoping to be able to do that in August. So if you're interested in our medical mission program, please check out our website, because they're all listed there under the medical mission program. And then we will probably have a few more before the end of the year and kick off our year again in 2023 to Uganda. So we want to thank you all for coming. And we'd be happy to entertain any questions that any of you might have. I think there's somebody in the chat. You can support the women to, oh, thank you very much. Someone,
Probably Paul.
I think it was Paul, who just added, you can, if you support the women in the brothel through the website support.partisanworldhealth.org/campaign/rising-up. Any questions or any comments? Do you have anything else to share, Marietta or Francine?
No, I think we've given you a taste. It's just a taste, but we have many, many stories.
Yeah.
It was a wonderful experience.
I just want to say also, what an amazing organization this is, an amazing woman that is Elizabeth is, to dedicate her life to doing what she does. It truly is an act of love on her part.
It certainly is.
Thank you, Janine. But this is something that I founded a long time ago, and I really, really believe in this. I believe that what we're doing is the right thing with collecting all these medical supplies and finding different places for them to go in all over the world. So many organizations and countries need our medical supplies that we are actually going to throw away every day. And I think that I feel that it's my responsibility to do my part. And I want to thank everybody else who has supported Partners for World Health in a variety of different ways, have come on medical missions, have volunteered filling a container, have picked up stuff, have donated funds to keep our doors open and help pay for all these warehouses that we have to rent and pay for. And what I really love to have you do is really help support us by coming to the Blue Red Project runway on May 19th. But Janine, thank you for saying that. I believe that it's important to find something that you want to make a commitment to something greater than your own self-interest. And that's what we do here at Partners for World Health. And we try to explain that concept to high school students and college students wherever we are, especially here when they come down to volunteer, because if they commit themselves to something, it doesn't have to be Partners for World Health, but if they commit themselves to something like autism or the disabled or the elderly, and they stick with it, then the change that they can create for that organization or for those people will be immense. So thank you all for being with us this evening and for supporting us. And we welcome you to come on a medical mission with us as well.
We have a raffle.
The raffle.
Yes, we do have a raffle.